Hello guys, I'm Sushma and I'm the student of Doctor of Pharmacy. I'm here to explain about dementia. Dementia is not a specific disease. Dementia is a group of conditions characterized it is characterized by impairment of at least two brain functions such as memory loss and judgment, etc. Currently, more than 55 million people have dementia worldwide, over 60% of whom live in low and middle income countries. Every year, there are nearly 10 million new cases are noticed. Alzheimer's disease is the most common form of the dementia and may contribute to 60 to 70% of the cases. And this dementia is currently the seventh leading cause of death. Dementia is a general term for the impaired ability to remember or think or make any decisions that interfere with the doing everyday activities. Though dementia mostly affects older adults due to the decrease in the functions of their brain cells, which is causes early damage. Here the introduction of the dementia. Here, what is dementia? This dementia is a syndrome that can be caused by a number of the diseases which over time will destroy the nerve cells and damage the brain cells, typically which led to deterioration in the cognition functions. The cognition is that the operation of the mind processes by which they become aware of objects of thought on perception, including all the aspects of perceiving, thinking and remembering, etc. The dementia consists of a variety of symptoms which will suggest that it is a chronic dysfunction of the brain. And the causes are the etiology include mainly this is happened when there is a damage to the brain cells. This damage interferes with the ability of the brain cells to communicate with each other and with others. When these brain cells cannot communicate normally, thinking, behavior, or feelings can be affected. The brain has many distinct regions, each of which is responsible for the different functions like memory to remember, judgment to answer or question any person, and the movement. When cells in a particular region are damaged, the particular function will be lost. The causes or the factors which will cause the damage to the brains include neurodegenerative conditions. Up to 60 to 80% of these, like Down syndrome, Parkinson disease, etc. And advanced age. By increasing the age, the damage to the cells increase due to decrease in the functions of the brain cells. Metals and toxins. Metals like zinc and copper will affect the brains, which causes damage and head injury or any brain tumor, etc. Stroke and vascular diseases, bacterial conditions which has meningitis and encephalitis. These are the factors or which causes the damage to the brain. Next, about pathophysiology. Here it shows that these three factors or other which was mentioned in the previous slide, like factors, risk factors, which led to inflammation. Here insufficient sleep and sedentary behavior and obesity. These are the factors which causes inflammation, and this will activate the interleukin pathway. Thereby it damages the endothelial cells. These endothelial cells damage led to small vessel diseases, which causes damage to the small vessels present in the brain, and it causes reduced cerebral perfusion, which led to brain atrophy condition and causes dementia. And next include symptoms and diagnosis. Symptoms is varied from person to person according to what the particular region is damaged or affected. Common symptoms will include forgetting recent information, that they cannot remember what they have said and what they are received from other person, etc. Difficulty in speaking, understanding and expressing their thoughts freely, or reading and writing. Misplacing of the commonly used items or placing them in unusual spots. Not knowing the season or the day which year they are living. The patient will take a long time to complete the daily tasks, and experiencing a change in the mood, emotions, behavior. They can notice their difference in the interest too. And the diagnosis include medical history, which will shows what's the condition of the patient previous, and physical examination, their behavior, emotional status and mental status, how they react to certain conditions, and how they interact or communicate with others. And laboratory tests include brain scan, EEG, blood and urine test, and vitamin B12 deficiency, thyroid test, glucose test, etc. Characteristic changes in thinking, and we can notice the difference day to day by examination. And the treatment include monoclonal antibodies, aducanumab, lecanemab, which is a new drug which was approved by FDA in 2023. Others include memantine, choline esterase inhibitors, which include donepezil, rivastigmine, galantamine. Here we can see how the monoclonal antibodies will show their action, and when the drug is administered, it mainly targets the amyloid protein clog which present in the brain. It is mainly seen in Alzheimer's disease, and this binds to the amyloid protein, and thereby this alerts the immune system which sends the signals, and thereby it break up the toxic amyloid and flush it out of the brain. Here we can see the difference between initial scan and 1 year later. The amyloid protein clog will be decreased due to the administration of monoclonal antibodies. And next, cholinesterase inhibitors, which is mainly used in Alzheimer's disease treatment, and this drug inhibits the enzyme acetylcholinesterase. The breakdown of the acetylcholine is decreased, thereby increases the availability or increases the amount of the acetylcholine which will available to the nerve cells, which will increase the cholinergic effects. And this memantine is a drug which is a NMDA receptor antagonist. NMDA is N-methyl D-aspartate receptor. It prevents glutamate action on the NMDA receptor, which causes it prevents glutamate action on the NMDA receptors, which causes the symptoms of the disease, thereby decreases the symptom of the disease. I come back soon with a new topic. Thank you.